Hi, everyone, and welcome back to LearnNeuroRadiology.com. I'm Brett Weinberg, the founder of the site. Today, we're going through case 3 of the brain imaging course. We're going to take a look at this case and kind of walk through it in an interactive fashion. So let's go. If you haven't been checking out these cases, you can check them out at the website. You can find the link at LearnNeuroRadiology.com/brain capstone or bit.ly/brain capstone. That's going to take you to the course. Then you just scroll down and go to case number 3, and you're going to be able to walk through this case with us. So case 3 is a 62-year-old man with new onset left side weakness, left facial droop, and right eye pain. So let's just get to the images. So for this case, we have a head CT. You see the regular brain window here, the top left window. We're going to double click that just to make it bigger there. We're taking a look at the whole brain window on its own. We're going to follow our regular search pattern, starting at the bottom. You see the brain stem here, some CSF around it. Looks okay. We're looking okay so far. So far, so good. Fourth ventricle, normal CSF spaces, kind of feeling okay. Once we get up to the temporal horn, I see a little bit of abnormality of the temporal horn here. It seems a little displaced, a little bit asymmetric. We see some medialization of the uncus here, so we're definitely worried something's going to be going on in that right hemisphere. And then we come upon this hyperdense material in the right hemisphere. It's got some edema around it, and as we scroll up, it's just going to get worse and worse. You have this big hyperdense hematoma here. You've got some edema around it. A ton of mass effect here. You see the midline is shifted all the way over to the left, probably more than a centimeter. Ton of mass effect here, ton of hemorrhage around. This hemorrhage, it looks like it's, we should try to figure out where it is. If we look, it's probably in the brain parenchyma. It's got brain around it, like on almost all sides. So it's probably coming from the brain parenchyma. So that's probably a parenchymal hemorrhage here that we're looking at. Tons of mass effect and swelling on this side. Let's go back and we'll take a look at some of our reformats here. We've got a coronal reformat here. We're just going to see a lot of the same thing. Okay, as we come from front to back, you already see the sulci on the right side are effaced. CSF spaces on the left, but nothing on the right. As you come back, you start seeing the same thing. Edema, hyperdense blood products, surrounded by parenchyma on all sides. And you've got this big hematoma here, several centimeters, probably 6-7 centimeters, pretty big. Tons of mass effect to the other side. Again, you've got herniation. You can see the medial temporal lobes herniating over there. You don't see the temporal horn at all. So a ton of mass effect, and the reformats can kind of just help you see that a little bit better. Finally, we can just take a look at some of the sagittal reformats. You're going to see the same thing. Big hematoma here. A couple loculated kind of things, but it sort of coalesces into a big hematoma here within the parenchyma. And so you're looking at a parenchymal hematoma. Even though this isn't a classic location, this is probably a hypertensive hematoma or hypertensive hemorrhage that's resulting in this big parenchymal hematoma. And you see a little bit of entrapment of that lateral ventricle on the other side with compression of the lateral ventricle on the right. So what do we have here? This is a parenchymal hematoma. We've got a big parietal hematoma. It's an acute intraparenchymal hematoma. That's why the patient's having symptoms. Again, we talked about sulcal effacement, so you don't see the sulci on that side. Some edema around it. Effacement of that lateral ventricle, definitely some entrapment of the left lateral ventricle, which you see here, because it's not able to drain CSF normally. And you see a little bit of edema around it, and that's paraventricular edema from acute hydrocephalus. Definitely left midline shift, definitely uncal herniation. You see the uncus here is pushing the midbrain to the contralateral side. So we have a question for you, and you can find the question on the website. But if the CT angiogram is negative for aneurysm or AV malformation, what is your next step in management? You can do a short interval follow-up. You can call neurosurgery for decompression. You can do nothing, or you can put in a ventriculostomy. Think about that for a second. Okay, so the first thing you want to do in a case like this is call neurosurgery, because this is a surgical emergency. They need to decide whether they want to decompress this to decrease the amount of mass effect there is so that the person doesn't get complications of herniation, because this can proceed pretty rapidly to death without an intervention. This is a companion case here. You see a parenchymal hematoma in the left thalamus. In this case, this person has a unique complication of a hemorrhage like this. You can see the hemorrhage here on the coronal view. And you see it spilling into the lateral ventricles. And this is what we would call intraventricular extension of hemorrhage. You see the ventricles here are full of blood. That's something we might call casted with blood, because they're just filling up completely with blood. And so your question 3B is, in a patient with intraventricular extension of hemorrhage, what major complication are they likely to experience? Are they going to get laminar necrosis, hemorrhagic conversion, acute hydrocephalus, or abscess? So think about that for a second.
This is a good.
All right, so these patients are likely to get acute hydrocephalus. What happens is the blood obstructs the outflow of CSF. It can be an obstructive hydrocephalus, such as a clot prevents the CSF from getting by. It can also obstruct the arachnoid granulations at the absorption level, and you can get a communicating hydrocephalus also. So this person is very high risk of hydrocephalus. They're probably going to get a ventricular drain to help out with that. So this is a case of hypertensive hemorrhage overall. The risk factors for that are older age, high blood pressure, very common to see in the basal ganglia or thalamus, like you saw in the second case. You can definitely get them in the cerebral hemispheres as well. And the pons and cerebellum, also very common locations. Intraventricular extension and hydrocephalus you saw in that second case. So those are complications you want to be on the lookout for. You want to report to your referring doctors so that they can deal with it pretty quickly. So thanks for your attention to this case. Be sure to tune back in. We're going to have more cases as we finish up this brain imaging course. So thank you for your attention today, and be sure to like the video and subscribe so you get notifications when the new videos come out. Thank you.